Welcome to our esteemed guests on this second panel. We have with us Honorary Brigadier Dr. Arvind Lal, the founder and chair of PathLabs. He does not need any more introduction. Almost anybody who has had some encounter with the healthcare system will have seen or taken benefit of the services of PathLabs anywhere in this country. We have Dr. Anil Kukreja, who is also joining us from AstraZeneca. Thank you so much, Dr. Kukreja, for being part of this conversation with us. We have Mr. Sanjiv Navangul, Managing Director and CEO of Bharat Serums and Vaccines Limited. Thank you so much for your time to join with us. And we have with us Dr. Aman, who's joined us from Tata Trust. And am I missing somebody here right now? I'm not sure whether we are having Mr. Srinivas also join us.
No, I think
right, sure.
For the next
Dr. Singh, you're joining in from Tata Trust. Thank you so much. Thank you so much. Right, okay, so it is literally lunchtime for many people, and I hope that those of you that are joining us on Facebook or via the various digital platforms, you do have the privilege of continuing with munching in front of your screens. We hope to provide additional food for thought while our esteemed panelists and guests join us. Please don't neglect your regular food or your regular tests and medicines at the cost of watching this program. Thank you all for joining us. I want continuity also between the first panel. Some of you may have joined in earlier and you heard some of the aspects that were being discussed, and I want to kind of continue on here too. We are talking in the context of Ayushman Bharat. We are talking about one of pretty much the world's largest health insurance provisioning, securing people from catastrophic financial expenditures on account of health. But we also have a flavoring to this panel, which is we want to focus on non-communicable diseases. In a year when everything has been focused around a virus, around an infection, around vaccines, around anti-infectives, antiviral agents, and things like that, I want us to kind of understand the fundamental role that non-communicable diseases have played in shaping the outcomes of this pandemic. People who have had diabetes, people who have had chronic ailments, whether it's related to their cardiovascular system or their renal system or their hepatobiliary systems, almost all of them have had worse or more stormy journeys through COVID than those that didn't have. And so therefore, we cannot have a conversation of health systems anymore. Earlier, when we talked about healthcare systems, it would be about maternal newborn child health. We would be trying to do infectious diseases. I think this has been, 2020 has been a giant shaking up and a waking up call for all of us to understand that health systems cannot be done without understanding the fundamental role that non-communicable diseases or systemic disorders play in shaping outcomes for us. And we can't get to that without knowing. I mean, people have talked in the earlier session about digital health and all of that. And I point out there, and I want to start there with my first question to Dr. Lal. People are thinking that digital health will allow for better management of people. And the point that I made earlier, and that the reason why I want to start with you is this. Computer systems do garbage in, garbage out. If you don't put anything in, you don't get anything out. If you put good data into the system, you'll get good outcomes out of the system, provided you know what to do with it. In our entire rolling out of our system, we still seem to miss out on early diagnostics, on simple diagnostics. How do we address this? We have this notion of health and welfare, health and wellness clinics. We have primary healthcare settings. We still do not have a push towards earlier, simpler diagnostics. How do we begin to address that, Dr. Lal?
Yeah, it's a complex question, Dr. Bobby, but I think you have got to get started somewhere. So first of all, the importance of these so-called NCDs, in the present time, they cannot be understated anymore, or cannot be overstated, I should say. So I don't want to rattle off the figures, but I'll just like to take 2 or 3 figures. That 41 million deaths every year globally, 6 million in India, more than 60% of all deaths in India at one point of time, and about 45 to 50% of the DALIs, that is the disability adjusted life years, have been found to be due to NCDs. Next thing is that the problem is also economic, and it all starts from the money, as you've hit the nail on the head inadvertently, with spending of 1.2, 1.4% on health by the government. Well, it's not going to take you very far. We shall discuss that a bit later. But let me tell you that if we don't control these right now, we were already 1.5% down of the GDP in 2015, which I think we may be now touching about 2%. And I don't have to tell you where the GDP has gone now, thanks to the COVID pandemic. So answering your question straight off, we need to do something. We are seeing in our own private practices that the NCD patients have started coming back. There was a stoppage of all these kind of patients because of too much of emphasis was there on the COVID-19, which was rightly so. But these people cannot be forgotten, because, as I told you, the 60% of deaths are due to these. And if we have a large proportion of these kind of people, coming to us. So the straightforward answer is that yes, there is in India, which is there also in the tier 3, tier 4 and rural surroundings. 70% of India is staying in these kind of places, in the rural surroundings, etc. And what do we do about them? I'm just not talking about the NCD prevalence in urban areas. Everybody is very fond of talking that, well, he went to this doctor, that doctor, etc., etc. And I think it is possible to control them here, but even the segment which is not controlled here, or which has escaped detection, is the urban poor. So there are two sets of people I'm talking about: the urban poor and the people in the rural area, and obviously they are poor. And for this, something has to be done. And I would like to say that I think it was Priya in the previous session who actually emphasized the need for somehow tightening up the health and wellness centers, etc. And of course, Dr. Bajaj talked about the handling of the secondary and tertiary kind of things. But it is the primary one in which the NCDs have to be controlled. So how to go about it is a next topic. We can, I think, talk about it.
Sure.
Fact of the matter is that, well, we have to start going about it now seriously. I have a few suggestions, but I think I'll leave it to you and to bring them in. Okay.
Thank you so much, sir. I pivot to Dr. Anil Kukreja. I mean, I'm fascinated by your backdrop. You've got the three systems there, and I speak to you, and we acknowledge you both from your corporate background, but also as a physician. I mean, how do we begin to intervene with those three pictures that you have behind you? How early is too early, or is there something called too early in intervening and preventing things from getting out of hand?
Yeah. Am I audible, Bobby? Yeah, thank you so much. So at the outset, I want to, in fact, thank Integrated Health and Wellbeing Council for arranging this brainstorming session. And I thank Dr. Bobby for bringing this topics for us. And I think we are privileged to have an opportunity to have the discussion and contribute through our thought process and discussions. I'll just begin with, in fact, the three systems on my backdrop is nothing but we have an initiative, which is a patient-centric initiative called as Take Care of Me. It's a very holistic initiative, because if you see on the extreme right, if you see the pancreas and the diabetes, the most common disease, which is like almost we have more than 70 million diabetics in India. And we will be close to 115 million diabetics by 2030 is what is projected figure based on our lifestyles and the way we are progressing. And if you look at the diabetes, it's not only taking care of the sugar. Diabetes affects all the organs, and I've shown the organs, particularly the heart and the kidney. And the recent evidence, if you see the heart failure, it's almost 44% of the diabetics will eventually land up into heart failure. So 8 to 10 million heart failure patients already exist, and this proportion is increasing significantly. We have a significant increase in the chronic kidney disease, and majority of this diabetics, heart failure and chronic kidney disease are not diagnosed at the early stages. And I'm just trying to bring, in fact, your question also. It's very important for each one of us, not only to spread this message, also I heard in the earlier panel, it's also the awareness of the population to reach earlier to the healthcare system. And at the same time, there has to be a comprehensive screening program for the population, depending on, of course, the age and depending on the comorbidities. Look at the holistic and comprehensive screening program implemented at the primary healthcare system, so that we are able to pick up at stage 2, stage 1, instead of diagnosing at stage 4 and stage 5. By then it is very, very late. So I would say, in fact, pick up early is the most important. And I will also highlight one important aspect of another non-communicable disease, which is cancer. We have close to more than 10 million cancer patients, and almost more than 1 lakh every year new cancer patients getting diagnosed. Again, if you look at the diagnosis in India vis-a-vis the other countries, India diagnoses at a very late stage. So 1/3 of this cancer patients actually are preventable in nature. Remaining 1/3 are we can diagnose early and we can treat them with the curative intent. And the only 1/3 where it is, unfortunately, because of the biology of the disease, it could be more aggressive. So it's very important that we not only have a comprehensive screening program at a primary healthcare system, but also crucial for us to integrate the private health. So it should be a public-private partnership in diagnosing early. And there has to be a lot of efforts being taken, because more we delay, more we are increasing the burden of non-communicable diseases for the country, and also it will hit the economy and also the country as well. So it's very important for us to do a primary prevention, particularly when you know the linkages between diabetes, heart failure, chronic kidney disease, and other complications as well.
Thank you, Dr. Anil. You bring, and then you kind of invoke the rule of thirds as far as cancer is concerned. And I turn to Mr. Sanjiv Navangul here. 1/3 can be prevented, 1/3 can be treated with good outcomes, and 1/3 you really need to manage. And I think the rule of thirds or variations of that apply to almost every other non-communicable disease. In fact, the prevention part of it actually is much larger in the non-cancer settings. How do we, whether it's from the corporate sector, how do we signal to a largely government-run, determined Ayushman Bharat, the signal that we need to intervene earlier?
Thank you, Bobby. Good to see you. I think I'm seeing you after quite some time, and nice to see my friend Anil also. So I think it's a valid question, Bobby. That how do you wake up people who are already awake? So it's a tough one. But let me explain by a simple statistic, and this might hit everyone hard. And probably we don't make these data points more popular. They're gory, but we have to make them popular. Mumbai city, during COVID times, population reduced by about 1.5 million because of migration. In that period, the number of deaths, non-COVID deaths, increased in absolute numbers. So therefore, as a percentage to population, there is even more increase in number of deaths. And they are non-COVID deaths. And we know today by the list of 10 major causalities for death, that it is basically NCDs. So now when you look at this data with that greater detail, we realize that something is dramatically going wrong when such things happen. Pandemics happen or whatever happens, things start to go wrong dramatically in NCDs. I don't think people get it. And unless we make a lot of noise around such simple statistic, people will not wake up and realize that what are we sitting on. Also, Ayushman Bharat tried to tackle what was the problem of today in terms of hospital admissions, in terms of surgeries, and laying down the rules for those and all. That's fine. I think it's a great job done, and I think we should appreciate from nowhere to somewhere. But we have to solve the right problem too. And the right problem is these people land up in that situation only because there is somebody who has not taken care of it before. And in that, our worry to extend Ayushman Bharat further to some of these things where people should take better healthcare is not done because we try to solve the wrong problem of trying to find, oh, there will be fraud. I'm not a fraud detecting agency to solve the problem of fraud. I am the gatekeeper of health of this country. I should solve the right problem. I want to ensure that Ayushman Bharat gets extended further to ensure that interventions happen at the right time. And Dr. Lal is quite right, in his saying that if healthcare expenditure is so low, how do we compete or how do we manage some of these things? And I always make this point, Bobby, that look, probably this percentage to GDP in terms of health expenditure sometimes doesn't register much. But there is another statistic which registers very quickly on people now, and I've been talking about it wherever I can, is the fact that amongst the top 50 economies of the country, India is the only one where defense expenditure exceeds health expenditure. The normal ratio of the rest 49 countries is 5 times of defense expenditure is health expenditure. And that includes, you take countries like China, US, you take all those countries also. So not only we are wrong in percentage to GDP in healthcare expenditure, we are dramatically wrong in our priorities also at times. So these are important things that we need to talk about. The third part, and let me stop here for the timing, is I think an NCD patient has to be an empowered patient. And therefore, what Anil said about programs like what he is talking about, ultimately an empowered patient will take better care of himself or herself. And Bobby, you have been in public health practice for a long time. I know you are probably one person whom I know. I don't have to even say a single word. When what I mean by this is that in reality, we have to ensure that patients learn to take care of their own health. And we have to tell them that doctor is your second option. First thing is how you take care of yourself. And if you do that, there will be pressure on the system that people will be more vocal, people will be more empowered, and people will speak out. They need to be taken care of, and we will see governments moving in that direction. Let me stop here, Bobby.
Yeah, thanks, Mr. Navangul. The thing that I want to kind of rephrase something that he said for our audience on the various channels that you're kind of following this conversation on. And I want to kind of rephrase it. The best defense of a country is it's in its people being well.
Yes.
It's not the number of tanks or planes, it's in its people being well and being productive. Because when you're well and you're productive and you're able to pursue your dreams, you will have the resources to compete or to put everybody else in their respective spaces. And if you don't, then you have to take recourse to other things. And this is where I turn to Dr. Aman Singh from Tata Trust. Thank you for joining us. How do we ensure that this best defense is not merely understood as protecting from TB or for malaria or for typhoid, but is also kind of ensuring that we pick up people very early on? If the body mass index is slightly off, how do we tell a mother or a pregnant woman that, look, you need to address something here? How do we ensure that, as Dr. Hema in the previous session said, we follow this person and her child through early childhood so that you're catching up and you're not putting them into a trajectory where they will be looking at a potential diabetes? These are things that Tata Trusts have done very, very well. How do we scale it up and ensure that these are the lessons that Ayushman Bharat takes on?
Good afternoon, all. And thank you so much for giving me this opportunity to speak. Although I joined this conversation just 5 minutes before, because my colleague has to go out for an important meeting. Now, coming back to you, Bobby, what you said. Now, one of the important factor, what we have all criticized government in saying that we are not spending too much, which is very correct. We are not spending at all. I mean, we are spending 0.9% of our GDP, which this government wants by 2025, maybe, or 2024, it may go up to 2.5%. But we also have to realize one thing, that at this point of time, I feel in healthcare delivery system, healthcare sector, actually this is a very, very exciting time in terms of government's approach in introducing this whole concept of Ayushman Bharat. Actually, Ayushman Bharat has two big legs. One of the leg with what we have really put forward and said that insurance piece, which is being popularized so much, and another leg, which is actually strengthening of this whole primary healthcare delivery system, including strengthening the PHCs, the sub centers, the CHCs, the sub-divisional hospitals, the district hospitals. Now, this itself, if it is strengthened well and if it functions well, our healthcare networks are pretty widespread and elaborate. I'm pretty sure that if it functions well, it will be able to take care of many, many, many situations. Now, one important piece which Ayushman Bharat actually introduced, which is a large-scale population level screening. Nowhere in the world that this population level screening of this scale actually goes on. We expect that nearly 550 odd million people, which falls into the category of being adult, somewhere in the age of about 30 to 65 years of age. So they will be actually screened. Our ANMs, our ASHAs will actually go door to door, identify people with high risk condition. They will bring them to either sub center or to the nearby PSC, screen them, and start identifying very, very early into the disease condition. Now, we all know that non-communicable disease is largely being a lifestyle disease, where we all, in spite of we all being a doctor, at least we don't do too much of exercise, we don't eat healthy food, but in spite of all that, our longevity is going up. So as longevity will go up by some condition or other, and that is what we have also seen in whole of the epidemiological transition that has happened in last 3 odd decades. We have seen that overall, globally, you will find the rate of non-communicable disease is bound to go up, because at the end of the day, the longevity has to stop somewhere, and something or other will actually kill us. But what is happening now is, if we start identifying people early, what Dr. Anil said, and even when you were saying that there is a rule of third. In India, we identify cancer almost at 3rd or 4th stage, where after you diagnose a case of cancer, the longevity of that person on an average is about 1.4 years, not more than that. Similarly, if we identify all the precursors of diabetes, hypertension, etc., at the early stage, we are definitely able to ensure that how we should be able to, ensure that this patient does not go into complications. So the effort what we have taken from these population level screening, now that is something which is a massive, humongous effort. The good part is that government of India is totally committed. There is a huge amount of political commitment and resource allocation for this thing. If we all come forward, and I will say that from the Tata Trust side, we partner with government of India to ensure that this kind of an initiative, which is taken at such a large scale, and this is something which is growing up. Other people can also come forward and start doing this. Being a physician, we will all appreciate that once people are identified early, it is easy to treat, and we can delay complication. And at the end of the day, the massive piece of Ayushman Bharat, where we actually require people to be treated when they have complication, when they get hospitalized, etc. Overall, the out-of-pocket expenditure for the same will also get reduced. So overall, what I will say is, from a public health point of view, that one piece of Ayushman Bharat, the comprehensive primary health care, that requires strengthening, and we will actually appeal to our corporate and other people, those who have some wisdom, to support that initiative. That will definitely go a long way in reducing the disease burden.
Thank you, Dr. Singh. And I want to kind of pick up one thing when I kind of come back to all our speakers once again into the next round of questions. Is this that, yes, we will have increased longevity. Life expectancy at birth has been increasing across the world. Just to put it in perspective, in 1950, life expectancy at birth in India was somewhere around 33, and the total fertility rate was somewhere around 6.7. Today, we are coming onto the cusp of our census in 2020. We should be comfortably slipping over, at least for women, into the 70 plus life expectancy. And hopefully for men also, we will have just slipped into the 70 mark. So yes, when we live longer, you'll have problems that are associated with older age. But that doesn't necessarily have to be that way. It is not right that we begin to see people in their early 20s with hypertensive features, or people with deranged body mass indices now showing up with urine sugar. Those set up for larger issues, best highlighted by what Ms. Navangul pointed out. At a time when the population of a city was going down, a strange experiment that happened, we actually saw larger numbers of people being morbidly sick or even losing their lives. And they were not all old people. Unlike in other places of the world, in India, we had younger people dying too. And that is something for us as a wake-up call and something that we need to do. I take on board what you've said. Yes, we have a very large push towards comprehensive care. In 2005, the government of India committed to 2.5% of the GDP for expenditure on health. In 2005, we repeated that in 2011. We repeated that in 2015. We're repeating the same thing in 2020. So the 2.5 number really needs to be taken with a grain of salt. What matters is what's being actually spent. And this is where I turn back to Dr. Lal. Yes, there is the ambition to comprehensive care. Yes, you've pointed out that we can do a lot better. Sir, with the experience that an organization like yours has in actually delivering, turning around, picking up, turning around, processing in between with highest fail-safe reliability, how do you transfer or how do you begin the partnerships that allow for such robust care delivery at the point of care or nearer to people's doorsteps?
Okay, Dr. Bobby, I'll tackle this question in two parts. One is the financial part by the government of India. So the government of India, as all of us have heard time and again, has now committed that they'll be spending about 2.5% of the GDP by 2025. So even if you start off right now, well, they've got to start spending some part of it. So I have calculated, 2.5, what would be our, GDP at that time. So what net, I'm giving you a figure now. So now we have to, start spending something like 1,25,000 crores every year, in addition to what we are already spending. Now that's a very, very, strong point, and we don't see that happening. And you heard a lot about the 20 lakh kind of incentive and rolling out by the 20 lakh crore during the COVID. But I don't think much came to the medical part. So point number one is that you have got to grapple with this figure, 1,25,000 crores in addition to what you are spending already on healthcare. Are you willing to do this? If you're not willing to do this, well, I think we can pack up our bags and go home. Second part is what the government has already tried and has been, somewhat successful, is that government's Ayushman Bharat program has got two pillars. So one is the 1,50,000 health and wellness centers to provide comprehensive primary care. And the second one is the Pradhan Mantri Jan Arogya Yojana, which is ABPMJ, which looks after 107.4 million families, or about 50 crore people, giving them a insurance cover of 5 lakhs per year. So this is what I want to say, and that there is no dearth of evidence to support that the primary healthcare or the HWC's level, very high impact NCD prevention and management innovation can be delivered here. There's no doubt about it. This is also an excellent economic investment because timely and effective primary care can act as a gatekeeper for more expensive and resource-intensive secondary and tertiary care. To make an impact at the primary care level, the government and the private sector, well, everybody says so, they must come together, but how? Now, this was also recognized as early as 2018 by the then late Finance Minister, Mr. Arvind, who said that the government seeks contribution from private sector through CSR, philanthropic, and other NGOs, in running these 150,000 HWCs. This is all in print, nothing new. So here's a suggestion from my side. So after having, been in practice for the last 43 odd years, so this is what I arrived at, that we must do something, from the private side, to do something in the primary healthcare. So we formed a foundation known as ALVL. No guesses what is ALVL. AL is Arvind Lal, VL is Vandana Lal Foundation. And this looks after only primary healthcare, and we have just gotten started. And we are now, going to concentrate on, the vision is to, transform primary care for the masses in India, long statement, and interventions at primary care level through smart HWCs. HWCs you've all heard, but we want to make them smart. To control the NCDs is one of the key endeavors of our foundation. And therefore, we have been doing some homework, and we visited a few centers in Almora district in Uttarakhand. And there you would be shocked if I, share with you all these things. So the random glucose testing was also not available at these centers. While one center did not have any glucometer, the other had one glucometer with supply of 30 testing steps per year to cater to a population of 5,000, people around. On further probing, we also learned that the centers received their allocated budgets nearly at the end of the financial year, say about the 1st of March, and they're taken away by 31st March because you can't spend them. So this needs to change, and primary care provisions need to be strengthened, and supplementing funding mechanisms such as CSR investment, not my words, the late Finance Minister's words, must also be enabled in addition to the funding by the center and the state government. So what we are proposing is that there is a great opportunity of private companies in the health sector to meaningfully contribute in their area of expertise. They're very important in their area of expertise, but for enabling the same clarifications or amendments in the CSR rules are required, which prohibit companies to do CSR in their core business. For example, a diagnostic chain like ours cannot take up free essential diagnostic testing in health wellness centers as a CSR activity. If this can be changed for the health sector as an exception, and we've already discussed that we need to do something, significant amount of CSR funds can be channelized to improve healthcare by contribution from the private sector. And lastly, the digital backbone of the Ayushman Bharat and launch of National Digital Health Mission, that's going to go a long way. So, just to take my argument further, today at 3 o'clock in the afternoon, we are signing an MOU with Government of India's, HWCs, but this time from Ayush. Ayush is giving us 3 centers, and non-Ayush, that is the normal health ministry, will give us 7 centers to become their partners. So we are very serious about it, but it cannot be just a one-way traffic for what I have already explained all of you. So that's all I would like to say. Thank you.
Thank you so much, Dr. Lal, and congratulations on your new initiative, which is the ALBL Foundation. And we look forward to how you will take those 10 centers and make them smart HWCs, as you said. Because really speaking, we do need templates and robust templates that are allowed, that people are able to then replicate and say, this is how it should be done. And then in that sense, our best wishes as you kind of begin this next phase of what's already been a very prolific journey on your side. Thank you so much.
Yeah, Bobby, I take this opportunity of inviting people like you and AstraZeneca, Bharat, Serum, and Tata Trust, of course, to come forward in this kind of an endeavor, because, we all can change primary healthcare together. That's all. Thank you.
And that's a call that we would kind of all, I think, have no problems in kind of responding to, because if there is a message that's coming through very clearly, is this, that nearly 75 years into our nationhood, we have to rethink our doctrine of health and put primacy into primary and early care. Because if we do miss out for silly reasons like only 30 test strips for 5,000 population for a year, then we're not going to get anywhere. They may not be very palatable statistics. They rank in the same order. I mean, they sound a little bit more sillier than the one that Mr. Navangul had pointed out in terms of mortality, but they eventually have the same impact. And that's where I want to kind of turn to Dr. Anil Kukreja. How do we flood the nearest to care, or even at home levels, the simplest tools that will allow for people to know that there is a warning flag already in place? What will it take? And I'll turn that then to also to Mr. Navangul and to Mr. Aman saying this toolkit, like every household pretty much has a tester. If you've got an electricity connection going on, some more or less has got an ability to kind of screw something on or just check whether the line is on. The equivalence of that for health. How do we even begin that? What is your imagination, Dr. Kukreja, on this?
Thank you so much. And I think I'll just build on to what Dr. Lal mentioned and also what Mr. Sanjiv Navangul mentioned earlier. Most important would be empowerment of our citizens and the patients community. And in fact, just to share, in fact, one of our initiative which I was talking about, so beyond glucose, when we talk about diabetes, people only think about glucose. So we recently, in fact, partnered with RSSDI to empower, and we have a goal that we will empower close to 1 crore, 10 million citizens, and by leveraging the technology and by educating them through the state chapters of RSSDI. And we would really welcome any other stakeholders to participate in such initiatives, where the whole intent is that how do we explain them that diabetes is not only about sugar. It is linked to so many other systems, and if you are able to diagnose earlier, you are able to save the end organ damage and further complications of the diabetes. It's very, very important to diagnose hypertension earlier, diagnose diabetes earlier. So these are very simple, and these are not very costly intervention. It's just a behavior change. And I am reminded here actually of a theory which is called as nudge theory. I think we need to do that nudging of the whole population to make that behavioral shift and take health accountability into individuals' hand. And that cannot happen without the partnership with the primary healthcare practitioners, without empowering our ASHA workers, the paramedics who are within the vicinity and operating out of the community. And I think this is a huge capability building which is required, huge volunteering efforts which are required. I think even Tata Trust mentioned the same. I think we need to ensure that each and every, and I think we have an opportunity today. Opportunity, although it's a very disastrous pandemic, but I think the way government is envisaging, and there is a political commitment from the government to ensure that the vaccination reaches to each and every high risk individual. And these high risk are nothing but people who are suffering from non-communicable diseases. So according to me, I feel there is a huge opportunity for us. The government is anyways collecting this high risk individuals. How can we ensure that we not only take this opportunity to vaccinate, but at the same time, important for us to do that behavioral modification so that at least the families, the communities are protected from having those behavioral changes within the families, within the community, on having the right early measurement of these high risk factors. Just like we have a state level burden of disease survey, which pointed out, which Dr. Lal also mentioned the figures, about 40 to 80% of the disease adjusted life years being wasted because of non-communicable diseases, I think it's important also to see how is the incidence of hypertension, impaired glucose, how is the uh, uh, awareness level for high cholesterol. So can we, these are easily modifiable high risk factors. We can actually, in fact, do a basic screening and nudge the whole population and community to do that behavioral modification. So I would just say that it's important to use that nudge theory to have a population level intervention. Uh, just to in fact mention about our partnership with Indian Cancer Society. Throughout the belt of Ganga and Godavari, we are partnering with Indian Cancer Society to do a early screening of the most common cancers. And we have been able to identify through a behavioral modification and attracting the common population towards the screening center, we have been able to identify the people who have suspicious nodules and suspicious cancer and able to refer them. It's not only identification. I think very important is that we close the loop so that they are referred to the right center so that a proper diagnosis and management can happen. This will help us in building the trust also in the healthcare system. So that's what I wanted to just emphasize on that behavioral modification theory.
Thank you so much for pointing to the nudge theory. I mean, it actually won the Nobel Prize, Richard Thaler's work, which is trying to kind of help people think through all the incentives that allow for them to do the right thing and how do you kind of use it in a policy sense. The difficulty, and this is where the NCD conundrum comes up, with infectious diseases, with other things, if you're sick or if something is happening in your body, it shows up very quickly. In many conditions, especially those that are of chronic nature, and that also is for tuberculosis or for HIV, many times you don't know that you're sick till a longer time in the continuum of the disease itself. And so what we in the clinical world say index of or indices of suspicion, they need to be built up, or an awareness of your body needs to be built up and inculcated into every one of us. If you're sick, if you're vomiting, if you've got a headache, if you've got a fever, you know something is wrong. On many things, you don't know things are wrong. Can we as doctors, can we as the healthcare fraternity, can we as the public health system begin signaling to the widest numbers of people that it's not just these that are warning signs, or even in the absence of warning signs, you actually need to go and get a preventive health checkup. Why do you go and take your two-wheeler or your car or your cycle to the mechanic for oiling and checking out whether everything is fine? You do so because you don't want it to break down. Regular servicing, if it's good for mechanical devices, is equally valid and valuable, in fact, far more valuable for the human body. How do we get that nudge into people? If we nudge, and this is where I pick up on what Dr. Lal said, if corporates, if pharmaceutical companies, if people whose core business is provisioning of healthcare products, if they start nudging, does that become a conflict of interest as far as corporate citizenship is concerned? Why should it be so? And those are things that we need to grapple at multiple levels. And so therefore, Mr. Navangul, how do we take nudges and how do we take the incentives, how the disincentives that are right now there for people whose core products might be actually helping people earlier on? How do we kind of get that conversation or that realignment done so that the ambition of the 150,000 health and wellness centers, we've got only 30,000, we've got another 120,000, and I'm hoping that the 10 that ALVL Foundation will do will give us better templates for doing it. How do we get this going in such a way that it benefits a larger number of people?
Bobby, we can talk about this until cows come home, but since so I'll divide it into very simple.
We have 9 minutes more.
Yes, so let me make it very simple and in a very few points. Yeah, I think index of suspicion has to be transferred to perception of threat, and then there is call to action. So we worry so much about index of suspicions that we don't really worry about threat perception. COVID has been, in a way, a great example where we can increase perception of threat substantially for NCDs. Like Bhopal gas tragedy, because of circumstances during this pandemic, aggregation of data is substantial. And we will clearly be able to throw out patterns by which make people aware that, look, NCDs have caused more harm in this pandemic than just COVID. And this could be a very, very important message to give to everybody. The second part of the story is that as much as we talk about primary healthcare centers, in which all of us have worked throughout our life to support, create a lot of activities, but I would also say let us also, and I've done a lot of work there also in preventive healthcare. I think instead of detecting early, why should we get detected is also another possibility. And I'll give you a simple example that look at the marathon culture that has started to sprout in this country. It started with a few, and I've been a big supporter of the Mumbai Marathon, and I've done a lot of work for them. But what it has done is, and people have to then make effort to participate. Yeah, I had to do a half marathon. I had to practice for 3 months. So what it does is it inculcates a habit of better health. And marathons are now sprouting all over the country. Are there any more 3 to 4 activities that we can create from a national scale? The other one, I think the Prime Minister himself is talking about yoga and popularizing it. But there are 3, 4 things that we can do, which will mean that we will ensure that there is a lot more activity, physical activity that people can engage in from an early age. And that can really delay the impact of NCDs substantially. The last thing I would mention is, or rather 2 things I would mention. One more is that fact that I don't think people get it, that when we look at cost of healthcare, cost of disease is not understood well. Today, hypertension and diabetes contribute to reducing 1% of GDP growth. 1% of GDP growth is brought down by hypertension and diabetes. And just calculate the value. You're talking of an economy which will be $3 trillion economy by 2025. What our ambition is. And the last thing I would say is that we also are short of doctors to ban primary healthcare centers and healthcare professionals. To augment capacity, we have to make it compulsory that whoever takes land from the government at a subsidized rate to build a third tertiary care hospital from private sector has to open a small medical school also along with it and make it compulsory to open it. It is a self-funding mechanism. People can charge fees and they can make their money, and therefore it is not that it is going to cost the hospital anything, but it will ensure that there is more capacity augmentation rather than the long winding process that we have to get an approval to start a medical college. It is like a process when by the time medical graduates start asking for permission, they would have retired by the time you get permission. So I think we can speed that up by putting some conditions. So let me.
And there are a couple of very interesting thoughts there, some of which are not in the scope of our discussion, but definitely worth something that ISW will pick up and further detail out. Earlier detection or even prevention, how do we prioritize that? And while this conversation has been around NCDs, some of the good, let's put it this way, evidence that's coming along for closer monitoring at home comes from the maternal newborn child health space. And Dr. Hema has kind of also pointed out very helpfully how home-based non-stress testing can be done so that you can kind of monitor out the progress of a healthy pregnancy. Can we kind of figure out what Ms. Navangul, you said, the index of suspicion translating to threat perceptions? How does that translate into now individual level actions that kind of then is mushrooming out? How do we signal all of that from a Tata Trust perspective, Dr. Singh? And how do you kind of then find, I mean, as the invitation has been given by the ALBL Foundation founder who's here with us, I'm like, sir, I'm using your new title right now. How do we kind of figure this whole change that looks to incentivizing earlier detection or earlier diagnosis and also preventive approaches?
I'll take on from where Dr. Sanjiv just stopped. One of the important factor is when it actually comes to perception of threat, then only then the call of action will happen. Important aspect is that if you really see our investment in actually educating people about their health. Now, health comes very last in our list. We hardly go and do any of the preventive screening checkups maybe in the chain of Dr. Lal's clinic itself. They offer so many of different types of checkups. But hardly do you find that us spending money proactively to get screened, because we all think that health is something which is absolutely guaranteed and nothing will happen to me. I mean, till it happens to me. Important fact is that we need to spend on health education. Now, this is something which we really don't do much. Small things that you have to stop smoking. Now, smoking itself is cause of many NCD conditions. Now, this is something which is easier said and done, although we have seen gradually the level of people who are smoking is going down, but still we have substantial number of people who smoke. Very simple thing about eating healthy food. Now, what are the healthy food? Now, in the era when we have so much of junk food all around, and we have seen that even in our rural population, which used to be so fit in terms of doing so much of physical activity, we find tremendous amount of NCDs in that population only because we don't eat well. Issues related to climbing stairs, doing small exercise, walking for at least 45 minutes. Now these are few of the things that will actually help people to remain fit. But what we have not done, or what we are doing less, is we are not propagating all these small little issues at the larger level. This government, at least the Prime Minister, has launched a program called Fit India Movement. Government is also promoting yoga, and now it's an era when we should be talking more about wellness than about sickness. So we have to move ahead. Few of the small things what people can do at home, like what has stopped us in educating our women folk to do self breast examination. Now that is something which is absolutely zero cost. They just have to palpate their own breast, and if they find there are any lump which uh, which uh, which can be difficult, they can come and visit their doctor and get it checked. Examine your own mouth and see if there are any ulcers, etc. So those kind of small things. Now what we have started seeing in COVID, one very good thing has happened. Is like one equipment that really got sold a lot was pulse oximeter. People will like to check at least as a surrogate that how is my SpO2 concentration. In a very similar manner, small things like we can just keep a tape in our measuring tape, do a waist measurement of yours, and then you will be able to know how your BMIs are. I mean, those are small things that we can do. Keep a weighing machine. Now, that is something which does not cost much, whether I am growing fatter or not. So, those small stuff which can easily be done, and these are small but a very pertinent marker for someone who can be a possible or a future NCD patient. Now, these are some of the things that we can easily propagate. From the trust's point of view, we spend plentiful on this whole primary healthcare delivery system. Recently, we had a MOU with the government of Madhya Pradesh, and there we are actually supporting strengthening of more than 500 health and wellness centers. So it will be actually those will be the so-called model health and wellness center for in 23 districts of Madhya Pradesh. Similarly, from the national perspective, we have the whole team which actually works with all 29 states and the 29 states ministry and with the central ministry on non-communicable disease. And our larger focus is to ensure that how techno-managerial support we provide to government to raise awareness about NCDs and ensure that people actually take care, and they should be linked to the whole issues of care. So that is what we do.
Thank you so much, Dr. Singh, and thank you for also pointing to the models that you are kind of building up in the state of Madhya Pradesh from your work with that state government in the design of health and wellness centers. And I suspect that between efforts like yours, the LVL Foundation, the other corporate social responsibility initiatives that each of your own organizations are now putting out, that we will have a greater push towards people understanding that it's better to prevent something. If you can't prevent something, at least get to know your situation earlier on. And God forbid, if things are too late, be aware that there are safety net mechanisms in place that you can take advantage of, so that it's, while you still are not going to kind of get a complete solution from your disease perspective, at least you will not be catastrophically out of pocket thanks to initiatives like the Ayushman Bharat. It's been a privilege to have you, sirs, Dr. Lal, Dr. Kukreja, Mr. Navangul, Dr. Singh, to be sharing of your wisdom, of your generosity with time, with each of us here at the IHW Council. We look forward to working with you in figuring out how we move from indices of suspicion to actually looking at threat perceptions to doing some actions. And some of you will have models, some of you will have ideas of how to kind of shape this conversation going forward. We've heard from the previous panel about the areas that we need to focus on, and communication will be part of the next panel. For those of you that joined us in the last hour, thank you so much for listening. If there is a message for you, it is this. To the extent that is possible, do examine what you're putting inside your mouth by way of food. You are what you eat. And so therefore, if you can be a little bit more mindful about what you eat, you will be a lot more better off in terms of your health itself. You are how much you sit. Sitting is the new tobacco. And in COVID times, for many of you who are sitting on this screen, sitting for 8-10 hours instead of going to an office, you are predisposing yourself to another set of problems. Please get into regular activities. You may not need to run the half marathon like Mr. Navangul had set himself a target for, but you can at least do a few flights of stairs like Dr. Singh has said. Take every opportunity to move around, because if you don't, we will only get ourselves into a bigger issue. It's a new normal, but the diseases are the same. I think there is a new normal, same cancer kind of a backdrop there that Dr. Anil Kukreja said. It's a new normal, but the diseases are still the same, and you have a higher probability of being into difficulties if you don't modify your behavior and if you don't take appropriate action. Thank you for joining us. Thank you for this time. Kamal, over to you.
Thank you so much, Bobby. And it was really a wonderful session, and the kind of thoughts rolled out that are really, really very, very useful, how we are going to build a society or a country which is focused more on prevention than just sick care. So thank you so much, Dr. Lal, for your time, Dr. Aman, Sanjiv Navangulji, and Dr. Anil Kukreja. We would like to present a digital mementos for your kind participation with the conclave. So may I request my team for the same? So thank you, Dr. Lal, again, and congratulations for your new initiative of health and wellness centers, smart health and wellness center, and I hope they are going to be the centers for integrated health and well-being, which will function in a smart manner. And we at IHW Council will be very, very keen and happy to showcase the success which you bring in as in your the present initiative or the venture. And we wish you all the luck and our best wishes for the same. Thank you so much. Thank you so much, Sanjiv ji, for all your support, patronage, and always advocating, that we as a country need to set our priorities right and make health before anything else, be it even, the defense or any other part, because the best defense, as we have come to know, and what you have highlighted very well, is that the having the population which is strong, which is healthy, which is productive, makes us better as a nation, a nation which can defend itself and can grow and progress to its optimum level. So thank you so much, Sanjiv. Dr. Anil Kukreja, thank you for your time, and we are with you in your advocacy and your push for making people aware about all that matters to their health, NCDs, and especially your, the big drive you are doing globally is that new normal, save cancer. So we are with you to, make sure that we take this information, awareness, and education to the people to be, to prevent and cure cancer on time. And thank you, Dr. Aman Kumar, for your insightful words and time. We are looking forward to work with more with Tata Trust and the institutions like this. All yours. Thank you so much.